As we age, our bodies change, and sometimes that means you need a new part. Joint replacement is a common occurrence that many go through. Here to discuss this and more is Dr. Sam Sidney of Orthopedic Associates of Central Maryland. Dr. Sidney, thank you so much for being here.
Thank you, Jennifer. It's a pleasure.
Let's talk about some of the major reasons that people would need joint replacement.
First of all, joint replacement is usually performed when a joint fails. Now, what does that mean? That means that the joint surface, the shiny cartilage, is worn away. A lot of times we think of that as an aging process, but usually it's as a result of prior trauma. Sometimes there are familial reasons for developing arthritis, and sometimes there are disease conditions such as rheumatoid arthritis that might cause joints to fail prematurely.
Does osteoporosis play a role in joint replacement or the need?
It is indirectly related to arthritis and the need for joint replacement, but a lot of times as we age, along with an arthritic process, our bones become osteoporotic. So I think it's very important that all of us take good care of our bones to make sure we don't develop osteoporosis.
You know, oftentimes we will go to the doctor as a last resort, you know, when the pain gets so severe we can't take it anymore. Does that often become too late, that you should have solved this problem, maybe gotten that joint replaced earlier, and you would be better off?
Maybe not necessarily too late, but sometimes you've missed the peak time to do a joint replacement. You're right. Oftentimes we've been told to wait until it's the last possible thing that we can do, but when you wait to that point, a lot of times we're deconditioned, our muscles are weaker. A lot of times depression goes along with that because we've been robbed of our ability to maintain independence. So our advice is when the pain becomes unremitting, that you go to see your doctor, make a correct diagnosis, try all those methods short of surgery to see if you can maintain a high quality of life. But when that doesn't work, then you need to weigh your options for joint replacement.
You're saying one of the common threads is age, that it's an aging issue. Is there something else that you're noticing, that a common thread, whether it's sports or people that are too active that might need joint replacement?
Yes, Jennifer, we are asked to be as active as we can because activity does have many positive attributes. It's good for our heart, it's good for our lungs, it's good for our whole musculoskeletal system. But along with that, sometimes we do get injured. And when we do have injury at a young age, that can lead to premature arthritis. Along with that, we tend to be a heavy society, and weight can sometimes overburden a joint and cause it to fail prematurely.
You know, it seems to be that when someone hears about getting joint replacement, or a joint replaced, I should say, that there's this fear that they're not going to be able to have the same lifestyle that they once had. What's the message, quickly, if you could tell us, that they can live a great lifestyle and still be just as active, if not even more active?
I think you've answered the question. The answer is yes, you can be very active. There are some modifications, such as running activities, which we discourage patients to participate in, but certainly living a full, active, independent, and most of the time a pain-free existence is the message for considering joint replacement.
All right, Dr. Sidney, thank you so much.
Thank you.
To learn more about joint replacement or to make your appointment, call Orthopedic Associates of Central Maryland at 410-644-1880 or online at mdbonedocs.com.